morning, everyone, and welcome. As Jacinta said, my name is Trish Lowe. I'm a registered nurse and midwife, and I'm responsible for coordinating the graduate certificates in neonatal care and child and family health. This morning, I'll introduce you to the ACN Higher Education philosophy and its relevance to adult learning in the online environment. I will describe the 5 main adult learning principles and explain how our students work collaboratively with our nurse educators to build their online presence and contribute to a vibrant online learning community. Educational philosophies and learning theory underpin all educational practices. They provide the conceptual frameworks used to describe an individual's acquisition of knowledge, skills, and attitudes to achieve changes in behaviour, performance, or potential. Understanding different learning theories helps educators select the best instructional strategies, learning objectives, assessments, and evaluation approaches for their students based on their context and learning environment. Common examples of learning theories include social constructivist, behaviourist, cognitivist, humanist, descriptive, identity, and meta theories. You may have had previous online learning experience or heard cautionary tales from friends and family explaining how isolating it can feel. There is no doubt that if it's not done correctly, this can be the case. For online learning to be effective, it must be student-centred, appropriately constructed, and delivered. The Australian College of Nursing's postgraduate online education is based on social constructivism, which recognises the impact of technological development, globalisation, and demographic change on the professional development of adult learners. Social constructivism was proposed by Russian psychologist Lev Vygotsky back in the early 1900s. Vygotsky claimed learning is a collaborative process, with a person's language and culture playing an essential part in their development of their intellect and worldview. He argued education was not simply the assimilation of new knowledge, but the process by which students were integrated into a learning community. Participation in a learning community requires motivation, time, and effort. Social constructivists see motivation as both extrinsic and intrinsic. Vygotsky maintained that our behavioural motivation is extrinsic, representing a reaction to positive and negative reinforcement. On the other hand, cognitive motivation is essentially intrinsic and based on the learner's internal drive and active knowledge construction. However, because social constructivists believe learning is essentially a social phenomenon, learners are also motivated by the rewards provided by members of their learning community. So in summary, when engaged in constructivist learning practices, students must be both self-directed to construct new knowledge through personal experience and prepared to actively engage with other members of their learning community. Their teacher acts more like a mentor. You might have heard these ideas referred to as flipped classrooms, or teachers being a guide on the side rather than a sage on the stage. So what are the differences between child and adult education? Adult learning theory is known and based on the ideas promoted by a German teacher, Alexander Kapp. As far back as the 1830s, Kapp argued adults' experiences, motivations, orientation, and need to learn differed greatly from those of children. Kapp elaborated on the essential qualities required by adult learners, both in general and for specific occupations such as nursing. He was also the first to explain the importance of lifelong learning for adults. Kapp emphasised that a person's inner qualities, such as their character, are foremost when it comes to adults' ongoing education and professional development. Malcolm Knowles was an American educator who further expanded on Kapp's ideas, especially in relation to professional adult education, or as we refer to it, continuing professional development. Knowles' work has been fundamental in guiding the development of suitable teaching strategies for adults. Knowles' ideas are significant in professional education because they focus on identifying and dealing with the differences between what learners already know and what they learn within the experimental elements of their programs. So let's consider you now and the motivations for pursuing postgraduate education that brought you here today. I'm sure you'll be able to relate to Knowles' 5 main adult learning principles. They are Number 1, self-concept. This means that as a person matures, their concept moves from being less dependent on others to being more self-directed. Number 2, adult learner experience. This is important for you as nursing and midwifery students. This point underscores the fact that as a person matures, they accumulate a well of experience that they can dip into as a valuable learning experience or as a learning resource. Number 3, readiness to learn. An adult learner's maturity influences their willingness to learn. As we age, we become increasingly oriented to development of tasks relevant to our social roles, such as our job. Number 4, orientation to learning. Our age and maturity alter our perspective from postponed application to knowledge to immediacy of application. Like me, I'm sure you can remember sitting in class wondering when you would ever have the need to use Shakespeare or trigonometry again in your everyday life. Now, as a postgraduate learner, you are more interested in seeking out relevant and authentic learning experiences that you can use straight away. This demonstrates how your orientation towards learning has shifted from being subject-centred to more complex problem-centred focus. And finally, motivation to learn. As people grow, their motivation to learn is internalised, meaning they seek opportunities for education and professional growth because they want to, not because they must. So how do these ideas resonate with you? Can you relate to any of them? Think about why you have attended today and why you are thinking about completing this qualification. Is it because it's a condition of your employment or next promotion? What personal and professional knowledge and attributes do you possess? And how can you use them to achieve your learning goals? Consider your current work-life balance and what practical measures you will need to put in place to ensure your course progression remains on track. For instance, do you need to secure funding? Do you have reliable internet access? Is it time to consider increasing or decreasing your work hours to better suit your anticipated study plan? And what human and material resources will you need to access to be successful? Our students are all adult registered nurses and midwives who come from various clinical specialties, geographic areas, and both public and private health settings. We relish your input and structure our courses to encourage you to contribute to our rich online learning community by sharing your professional knowledge and expertise. To learning combined with David Kolb's experiential learning model, devised in the 1980s, which emphasised the extent to which adult learning must be action and outcome-based. Kolb theorised that new experiences provide impetus for the development of new ideas. Kolb once stated, "Learning is the process whereby knowledge is created through the transformation of experience." This image illustrates Kolb's experiential learning theory. As you can see, it is a 4-stage process that involves having an experience, reflecting upon it, learning from it, and then trying out this new knowledge in practice. I'm sure that all the nurses and midwives here today will recognise this as the basis for reflective practice. Collaborative and experiential learning methods require students to develop their teamwork skills and to view individual learning as essential to the success of the whole group. In practical terms, collaborative learning is a process of peer interaction that is mediated and structured by an educational leader. Here at the college, our leaders are nurse educators who may engage with you as your tutor, unit, or course coordinator. Our nurse educators post in online tutor and student forums, conduct regular Zoom sessions, and present your coursework in a range of innovative and interactive ways. We construct your coursework and assessment tasks, as Emma mentioned, in collaboration with industry experts, so that we know they meet workforce requirements and remain relevant and authentic. To successfully complete these assessment tasks requires online discussion, peer review, reflection, academic writing and referencing, and the application of nursing theory to practice. Some typical assessment types include essays, reflective essays, and analysis of care. Some of our more innovative assessment types are concept maps, narrated PowerPoints, or poster and abstract presentations. So to summarise, I've spoken about adult learning in the online environment and the ACN higher education philosophy. I have described some vital adult learning principles and explained how we encourage you to enact these by collaborating with your fellow students and our nurse educators to make meaningful contributions to our online learning community. I hope this presentation has been helpful and I welcome your questions. Thank you very much.